So now tell me about your experience in the interview board, how you felt, how was the questions from the day one, I mean from the beginning of your like UPSC board interview till like maybe some experience of your colleagues also you can add, and that will definitely help the aspirants who are preparing for the upcoming UPSC exams.
Mine was the last roll number. I was the last person to be called in UPSC interview. The interview was on 24th December.
Okay. That is 2021.
Yeah.
1 year after the exam.
Yeah. Because of COVID, the process was actually delayed.
Yes.
I was the last person, and it was in UPSC body in New Delhi. Okay. There were 2 panels, but at my time only there was 1 panel, because only 3 candidates were there. On rest of the days there were many candidates, but in my day only there were 3 candidates. And this last roll number, first roll number, is not decided upon the rank. It is actually randomly sifted. So mine was in the last roll number. 1 was an IS officer and 2 subject expert, as I've already told. So the first question to me was by an IS officer. He interrogated me about my hobbies. Since I filled it a group discussion and debate, so he asked me the difference between what is group discussion, what is debate, on what points you are going to judge a person who is giving a debate on group discussion. Then he framed one case. He said, my wife has died from COVID, and I am having the sort of some swelling in the parotid gland, and I am experiencing dryness, anxiety, palpitation and all. So what will be the diagnosis?
Okay.
So, and how will you approach this case? So I answered it. It can be this, it can be an anxiety, or first of all we'll go to general parameters like checking of blood pressure, pulse. Then after basic examination, he was asking whether you will go for investigations or not. So I replied that not directly to the investigation. First of all, we'll complete the basic case taking examination, physical examination, and like all. So he used to frame one case and ask you about your approach in that case. Then it was the turn of the subject expert. They asked me about the medicines for varicocele. They asked me about male infertility. What are the reasons for male infertility? How will you, if the case of undescended testicles come to you, whether will you take the case or not? And the child is of 18 years. Since we know that undescended testicles has a chance of malignancy, and thereafter as the age grows, the chances of descent of undescended testicles also decreases. So I answered it that I will take the case, I will treat it, but with a caution. I will not treat it for prolonged time. I will treat it for say 3 months. And if the response came, it will come in these months. Otherwise, I will refer the case to a surgeon. So like that. And another subject expert asked me about the difference between miasmatic medicine, anti-miasmatic, why we call it miasmatic, not anti-miasmatic. That was actually a tricky question what I considered. So I just adhered to the point that medicines that used to counter effect the miasm, that swipe away the miasm completely from the person, is known as anti-miasmatic medicine. And then she asked why it is called anti, the homeopathy works on similia. So, but at that time I maintained my patience, and since I have learned from YouTube videos that even if you don't know a questions, don't negotiate, just say that I will learn or that. So without using much of the hand gesture and showing my anxiety and nervousness, I dealt with it. Then she asked me about the point in why we need diagnosis in homeopathy. So I mentioned why we need it. Then I was about to finish and leave it out. One interesting thing happened. When I went it out, I just wished thank you. And at the last, when I was taking the exit, I was on the door. I just wished Merry Christmas to all, since the next day was Christmas. So I think that is an important part of interview. That is a game changer for me, because it is not only the wishing of Christmas, but it is the awareness that tomorrow is a 25th December. It is not my gesture, but it is my quick response that came. I don't know how it came to my mind.
You have not prepared that?
No, I haven't prepared it. But at the time of leaving for the interview, when the date was 24th December, I have read it. What is 24th December? What are the special events that have taken on that place? Because I have heard in IS interview that they used to ask, you have came for the day of your birthday. What is so special about it? What is the meaning of your name? Why? What is 24th December celebrated all around the world? What is the temperature of the Delhi city? In that way, I have learned it. So maybe because of that, I got a chance and I wished Merry Christmas, and they all replied very warmly. So I think that was that raised the points in interview what I expected.
I feel, even though you have not directly prepared and come about that, this actually was there in your subconscious mind because of this kind of a disciplined preparation. And whatever you have mentioned, one more question, that infertility and varicocele, etc. That was a direct question from the subject expert, or you made them to come to that question? So I have heard that some of the interview, those who successfully completed some interviews of civil service or UPSC or PSC exams of some state boards, they have told sometimes we can manipulate the interview board. Like for example, they may ask you what kind of cases you are seeing in your clinic or what kind of cases you are seeing in your college. So you can tell actually, like if you are very good in Metromedica or therapeutics of respiratory system and dermatology, you can tell respiratory and dermatology cases, even though it is not like that. So is it a question based on that, like that infertility, varicocele, etc.?
No. Actually, it was a question after the IAS has finished asking. So that was a direct question. I haven't suggested anything from my side. And this redirecting the questions can be done if the interviewer, if you want to do so, but they haven't asked me in that way, and I haven't also suggested that this is my expertise or I have worked in that. I haven't mentioned it, and my dissertation and all was with some other was with the subject expert. So that was a direct question.
So your dissertation also don't have any connection?
No, with this.
Okay. And because one more UPSC like aspirant or those who have got selected after the interview, she also mentioned me that many questions regarding infertility, female infertility was there for her. So maybe I think this is a question prepared by them, because it's a like scope of homeopathy nowadays, infertility and homeopathy. So maybe that.
Yeah, that's why.
So what other things you want to share, or your colleagues' experience in the interview, or any other things regarding the preparation of UPSC, preparation of the interview?
I've at the time of days of interview only, I have asked my colleagues what all sort of questions they are asking. Actually, they are basically asking from the subject matter only. And like they are asking Murphy, what is Murphy triad, Murphy's sign, Murphy's law. They are asking from thesis. They are asking about tell some characteristic symptom of ornithogallum or like that, based on your research topic, on your thesis, what you have done. And they are asking what is primary action, secondary action, intermittent fever, how will you manage the case of appendicitis with homeopathy, Avogadro's number, like that. Mixed questions from surgery, practice of medicine, obs gynae, and all sort of question. But not very far away from something that we expect in UPSC. We are going to answer very unrealistic or some formative questions, some administrative questions that were actually not there. It was basically based on what you have done and what is your favorite materia medica, what are the types of materia medica, and all related to your subject matter. And since we are doing MD in homeopathic materia medica, they can ask about source books and all. Like this only.
And what I see just now, what you have said, your colleagues' questions, some theory parts which we prepare for the organon exam part, for the theory exam, that directly they are asking. So that means even though you are preparing very well, very properly for your theory part, some questions may not come. Some areas which is frequently asked may not come for the exam, but they may be useful for the interview. So,
the question of male infertility, I remember it used to come in obs and gynae, and in obs and gynae only a very small weightage is given to male infertility. And that question that I prepared in third year actually helped me in the interview. Otherwise, it is never asked anywhere. We are not having andrology as a separate subject. We are having gynecology. but that was asked in interview. We are not having frequent so many cases of varicocele. We are having cases of other like hemorrhoids. We are having cases of fistula, but the question was from varicocele. So you never knows from which knowledge, from what application of BHMS can come to rescue at the time of interview.
Not only that, I feel, to add on to your point, like the preparation of UPSC or a state PSC where an interview will be there later will be good if you are not selective, like only materia medica subjects, I mean homeopathic subjects. If you select, I mean if you do like that, you may be able to clear the theory exam, I mean with good marks. But if you are covering everything, like the important topics of surgery, gynec, everything, that interview will be little more, I mean, relaxed. Any questions you can face actually, I feel.
That is there because this is not the interview for the teacher of materia medica. This is not the interview for the lecturer of any subject. This is an interview of a medical officer, research officer. Yes. And right now we have an interdisciplinary approach towards things. So whole things collectively to be answered will be more better as compared to going deep in one subject, preparing deep in one subject. Regarding this UPSC, I have seen in previous paper, not much. There are some questions asked from materia medica pura, from chronic disease, from some books that we used to read in PG, not in UG. So for that questions, I would suggest कि don't go for reading materia medica pura just for the sake of UPSC preparation, because these books are so vast. And the questions will be like 4 or 5 out of 150, some out of the box questions. So focus on easy things, and if such questions came, so if you know it, then it is a luck for you that you know the line of that materia medica pura of that medicine and you can take the right answer. But even if you don't know it, don't focus on the difficult parts or the rarely used topics in the paper. Focus on easy things, try to crack those easy things instead of focusing on such questions, because few questions will be from out of the range, that is actually, but don't focus on that. If you know it, you came to know during your tenure of PG, during your tenure of practice through that line of materia medica pura, through that line of cyclopedia, then it is good, well and good. But if not, don't worry about that, focus on easy things. And regarding from when to start the study of UPSC preparation, because this paper can be given by UG, by PG as well as practitioner. So I will suggest that since it is very close to MD preparation, internship is the best time. Till 4 years you just focus on your subject in detail, read it nicely, attend your clinical classes, enjoy your time of UG. But at the time of internship, you should summarize everything in the form of competitive examination. Focus on MCQ orientation pattern. But for PG, I will suggest, since we have already read it, so we don't need that in MD. Instead of enjoying MD, instead of practicing in MD, instead of reading the new books in MD, if we are again sitting back and solving MCQ all the 3 years, will be an injustice to your PG. So what I think, at the time when the interview advertisement, from the written exam advertisement appear and the form filling start, and the gap between the form filling and the paper is around 4 or 5 months, I think that time is sufficient for serious preparation of UPSC exam. Instead of spending whole 3 years in preparing MCQ in a very diffusive manner, we should concentrate ourselves from the time of advertisement till the time of written examination for UPSC. Now many persons also ask whether to take coaching or not. If you are understanding things, solving the questions, getting the good marks in MCQ, out of 100 if you are able to get or solve 80 questions in an average asked paper, you don't need it. But if you are not able to do that, or your basics are weak, so we can go for coaching. That coaching and your smart work, actually coaching saves your time. The experience of someone, of some senior or the expert advice will prevent you from making the same mistakes. This is the role of coaching only. Otherwise, very special coachings or very special setups, this is not at all needed for a medical officer preparation. It is your past knowledge, your experience, and what you have been reading through your PG days, UG days, that will be self-sufficient.
So for the AIAPGT exams and the UPSC exam and interview, overall, if you summarize it like as a take-home message for our viewers, how you will do that? I have seen a very disciplined preparation in you from the internship time and even your undergraduation time, BHMS time onwards. You have attended the coaching classes or special classes for the allied subjects, and after that you have attended some quiz programs on Mathematica. Then coming to the preparation by purchasing books from Kolkata, then extensive preparation, and for UPSC some sort of a serious preparation in the level of interview, etc. So how you will summarize and give it to the viewers?
The day when we opted for biology and we thought that we will be doctors for the suffering humanity, so that was our aim. Our aim was not to be a UPSC medical officer. Our aim was not to be a research officer. The aim that our master has a vision, Honeyman has a vision, is not at that there will be a post of medical officer, research officer, CGHS. These are all secondary things. The aim, first of all, is to be a good homeopath. And that goal of being a good homeopath encompasses everything in that, and these are the byproducts of that. Research officer, medical officer, or etc. etc. So I think a student who has came to BHMS should study his subject, is do everything which helped him to become a good homeopath. I know in the world of competition, you also need a smart work or goal-oriented work. For that, I already told internship is the best time. I already told the books, less books, but reading it thoroughly would be more better. Then that preparation only will help you throughout your future in your competitive exam as well as in your MD entrance examination. And after you have cleared this for this sort of interview, this whole of your experience, the whole of your work at PG institution or UG, that whole combinedly will help you in the interview also. But as such, no special preparation. I have seen many students that used to solve MCQ day and night, and focusing on that and leaving the rest will not help, I think. You may be selected in research officer, you may be selected in medical officer after solving MCQ. You may crack the interview, but you will be doing injustice with your profession, because our country, India, does not need the MCQ solvers. We need a good homeopath that can take homeopathy to a new heights.
That's indeed a great message you have given, and it's going to be one of the best lines in the history of homeopathy, I would say, because it is a much needed reminder what you have given now. And let me ask something related to your future plans. Like you're going to get finished on your MD and you will be joining as a medical officer. So what are your future plans?
My future plan would be, since I've completed it, and in November most probably I will be joining it. So I will be most probably applying for PhD. Okay. For a better future outcome. But I have an interest in seeing patient. Okay. And that is actually was my primary interest. And when I am coming over here, I remember one of my line of my teacher, that our country needs the serious and an ardent homeopath rather than these medical officers and research officer. Yes. One needs to be a master in his profession and a good prescriber. That is seriously lacking, very seriously lacking nowadays.
Through those kind of practitioners, only homeopathy came to this kind of an awareness state.
Yes,
and
definitely.
Now the majority are spoiling it.
We are actually enjoying the seeds.
Yes.
We are enjoying the fruits that have been sown by our ancestors.
Yes, exactly.
So one should be an ardent in that how to be a good prescriber. If you are good, as is said in Three Idiots, the success will come to you. Yes. So I think it was, I haven't done, since you have came to know that I was not serious at the time of form filling. I was not ready to be this, but still I have got a position and an opportunity to be a UPSC medical officer, selected through it. So I think that it is all the blessings of God. It is the blessings of my grandmother, my grandfather, because they were in government service. It was their blessings, the blessings of the family, that I have got this opportunity, because I have won the battle for which I have never fought.
And I see that you're a most eligible bachelor in homeopathy right now in India. So what are your plans regarding your future family plans, family life?
A nice one. Actually, I'm still single and looking, since my family is of hardcore homeopaths. Okay. So I'm still searching and looking for someone who can carry the royal legacy of homeopathy in our family and take my family in a positive direction.
Yeah, we wish and pray for that a very lucky person, a best person will come on your way.
Thank you so much.
So throughout your journey from 2018, like internship joining and going to Kolkata and purchasing the books and preparing and writing the exam and getting into the top, then again in your 2019 attempt All India Rank 1 for AIAPGT, and in the PG life, a hectic PG life, getting cleared with All India Rank 1 for the UPSC Medical Officer Researcher Officer exam. Throughout your competitive exam journey, I am seeing a disciplined way of preparation, a kind of proper way of preparation. So what do you want to summarize regarding your preparation to your our viewers?
If you are serious in your studies at university exam, if you are serious in your OPDs, if you are having an opportunity to be with good teachers, good practitioners, it is not a very stressful sort of thing to attain get the rank and being selected. If one is serious, and not serious, but the words of Dr. Gaurang Gaikwad, that to be successful you have to be jujharu. In Hindi, the jujharupan means, in English it is madness. If you are mad regarding something, then definitely you don't need a disciplined life, you need a stressful, and you don't need to be a type A personality, but being very simple, normal and mad in that thing, passionate in that field will bring success to your feet. And again I will repeat my words that India needs the very serious, the earnest prescribers. We don't need that very disciplined. We are not the persons like administrative officers having a goal from the beginning to get into the jobs, but we are doctors, and a patient and the suffering humanity really needs us. So it is the journey of a doctor, and these jobs and the post are all the byproducts of it. So if we are vigilant enough, if we are passionate enough about our profession, definitely the success we will achieve in such fields.
And that was one of the wonderful experience of having a wonderful conversation with a very good person, and Dr. Harshit has come up very prepared for guiding a lot of people who are coming on the way for AIAPGT or UPSC as aspirants in the coming years. And Dr. Harshit, I would like to thank you from bottom of my heart in the name of Friend of Health and myself. Your very wise words and valuable words is going to help a lot of aspirants who are preparing and looking forward to our channel for some guidance. And thank you once again.
Thank you. It is actually my honor. I am a very simple student that had completed his UG from Kanpur State College and then PG, and I've got so much love, affection, not from only the people at NIH but from all over India, and it's my honor to give an interview to your channel, and I wish you all the best. The thing that you are doing right now is a very recognizable thing in the world of digital science and advanced technology. The videos that you are making will be helpful, as I have mentioned already, that I have also gone through several YouTube videos, and for preparation and for learning I also used to see YouTube videos, will be very helpful, and I wish you all the best for your YouTube channel and for your successful endeavors in the field of homeopathy.
Thank you, and I hope we can see your presence also in this digital world as a teacher and guidance, as a mentor of homeopathy.
Sure, I will try my level best.
Okay, thank you. And thank you all for watching this interview, and please leave your valuable comments and feedback regarding the interview, and you can chat with us in our app Friend of Health from the Play Store. You can download it, and also regarding the future episodes which you would like to see, you can actually comment below. And while starting the channel itself, we have mentioned we'll be doing this kind of interviews with people, and as a channel which is in its very much infancy of only 1 or 2 years of existence, we have got a very good I mean, we are very privileged to have this kind of a person today, and once again I'm thanking him and winding up the video. Thank you once again.